Hi, I'm Marnie. My population for my binder is neonatal, and I don't have a baby to use a real baby, but I borrowed this lovely baby from work, and I'm going to use that for my assessment. So I'm going to start with head, head, face, neck, and start with that. So first, when we get an admission, we inspect the baby first, and in inspecting the head and the face, what we do is we look at shape of the head. We do head circumference. We look at the sutures. The sutures should be open so that the skull could grow, so that the brain can grow. The skull can accommodate that. We make sure that the fontanelles are open. The anterior fontanelle should be the biggest one, and the posterior one should be open as well. They should be full but not, and flat, but they should not be bulging, and they shouldn't be sunken in. Sunken in means that the baby's dehydrated, and full means there's too much fluid, so maybe there's some hydrocephalus. Depending on how the baby was born, there could be some molding, which is normal, and if they used a vacuum, there could be some caput, like a little bit of swelling. But if there's a lot of birth trauma, there could be a hematoma, and that is not normal, so you want to look for that. And you want to measure the circumference and look to see if you have microcephaly or if you have macrocephaly. So you want to definitely note that if there's some abnormalities. And then in terms of the face, you want to look for symmetry. This baby is nice and symmetrical. You want to measure the eyes and look for, to make sure that there's no, that the eyes are nice and even. And you want to make sure that they're separated normally. You want to look for the red reflex. You want to look at the ears and make sure also that they're spaced properly. So low set ears are indicative of Down syndrome. So you want to check that off. And then you also want to look at the nose, and you want to make sure that the nares are patent. So we always pass an NG tube through both sides, because if it doesn't go into one side, or if it's kind of blocked, then that's indicative of some kind of atresia. So we always want to make note of that. And then the mouth and the throat. We look at the mouth and the throat, and we put a gloved finger in and feel inside, and look for the palate, indicative of cleft palate or a high arch. We look at to see if there's any teeth or the tongue. A large tongue is indicative, again, of Downs. To look if the frenulum is attached for tongue tie. And then last, the neck and the clavicles to see if there's any kind of fracture or crepitus. Thank you.